Hey everyone, welcome to today's Explainer. I'm actually going to be putting on my doctor's coat today because we need to talk about a literal, invisible, shape-shifting threat that might be hiding right in your own backyard. We are talking about the Hanta virus. Whether you're a high school biology student, a homeowner staring down a really dusty garage, or honestly, just someone fascinated by medical science, this is an appointment you absolutely do not want to miss. We're going to break down the symptoms, the diagnosis, how we treat it, and most importantly, how to keep yourself safe.
Okay, so here's the game plan for our appointment today. We're covering 5 big things you need to know. Number 1, the rodent connection. Number 2, a tale of 2 syndromes. Number 3, spotting the signs. Number 4, treating the infection. And number 5, protecting your home. Let's get right into it. All right, starting with thing 1, the rodent connection. First things first, we've got to figure out who the bad guy is here and how it actually sneaks its way into the human body. So Hanta virus is what we call an RNA virus, and the absolute key word you've got to remember here is zoonotic. Now, in the medical world, zoonotic is really just a fancy term that means a germ or a disease that jumps from an infected animal over to us humans. And in the specific case of Hanta virus, those animal hosts are rodents. We're talking primarily rats and mice.
Now here's where it gets wild. You might think, oh, I'm going to get infected if a rat bites me, right? No! While a bite or scratch can technically happen, it's actually incredibly rare. Instead, this virus spreads through their dried waste. When rodent urine, feces, or saliva dries out on the floor of a shed and you go in there to clean, you disturb it. That kicks it up into a microscopic aerosolized dust cloud, and without even knowing it, you breathe that invisible viral dust straight into your lungs.
And this is the part that is so incredibly tricky for us doctors. After you breathe in that infected dust, you don't actually get sick right away. No, it can sit there for anywhere from a single week to a staggering 8 weeks before you feel your first symptom. I mean, think about it. By the time a patient finally feels unwell, they've almost certainly forgotten they were even sweeping out an old shed 2 whole months ago.
Which brings us nicely to thing 2, a tale of 2 syndromes. It turns out this virus attacks the body very differently depending on where in the world you happen to live. Okay, so at a microscopic level, the Hanta virus targets your vascular endothelial cells. That's just a highly technical way of saying it makes the inner lining of your blood vessels act like completely leaky pipes. But here's the geographic split. In the Americas, the virus causes Hanta virus cardiopulmonary syndrome, or HCPS, which predominantly floods the lungs and puts massive stress on the heart. But if you look at the viral strains in Europe and Asia, they cause hemorrhagic fever with renal syndrome, or HFRS, and that version primarily attacks the kidneys and causes internal bleeding. Just to give you a bit of context on how rare, but still very present this is here in the United States, the CDC recorded 864 confirmed cases over roughly 30 years, from 1993 to 2022. It has popped up in about 40 states, but you're mainly going to see it concentrated in the rural parts of western states. Think California, Washington, Arizona, New Mexico, and Colorado. So yeah, it's rare, but it is very real. All right, moving right along to thing 3, spotting the signs. Let's look at what actually happens when a patient walks into my clinic or the emergency room feeling sick. For the lung-based syndrome that we see in the Americas, the timeline is, well, it's terrifyingly deceptive. For the first week or so, you get a flu-like prodrome. That just means early warning signs that feel exactly like you've caught a harmless everyday flu. You know, fever, chills, maybe your muscles ache, your belly hurts. But then, usually right around day 4 to day 10, it's like falling off a cliff. You drop into this cardiopulmonary phase where you suddenly develop a cough and can't catch your breath. Within literally hours, those leaky blood vessels cause your lungs to rapidly fill with fluid, sending the body straight into shock. Meanwhile, over in Europe and Asia, the HFRS syndrome rolls through 5 really distinct stages. It kicks off with a sudden, acute high fever and terrible back pain. You also see super distinct physical signs like blurred vision, bright red eyes, and a flushed face. And as it gets worse, it culminates in internal hemorrhaging, a dangerous drop in blood pressure, and your kidneys essentially shutting down. Because both of these syndromes start out masquerading as the regular flu, catching it early requires us doctors to be super suspicious. I literally have to play detective and ask, hey, have you been traveling? Or have you been cleaning out a garage with mouse droppings lately? If you say yes, we immediately run highly specific blood tests. We're looking for your body's defensive troops, the IgM and IgG antibodies, or we'll run an advanced test called RT-qPCR to hunt for the actual viral RNA. It's basically like dusting for the virus's microscopic fingerprints right there in your blood. So, what happens when those tests come back positive? That brings us to thing 4, treating the infection.
I'm going to be completely real with you for a second because you need to understand the gravity of this virus. The estimated global mortality rate for Hanta virus is up to 40%. For patients in the Americas dealing with the lung syndrome, about a third of those who develop breathing problems tragically do not make it. And what's even more heartbreaking is that most of those deaths happen within just 24 hours of getting to the hospital. It just moves incredibly fast.
And the truly harsh reality of modern medicine right now, we don't have a magic pill for this. There is absolutely no specific approved antiviral medication that cures it. We've tried testing drugs like ribavirin, but to be honest, they just haven't shown any real survival benefit for patients fighting the lung-based version of the virus.
So instead of a cure, we physicians have to go all in on what's called intensive supportive care. This means getting you straight into an intensive care unit. We might need to use mechanical breathing machines or an incredibly advanced life support technology called ECMO, which is basically an artificial set of lungs outside your body that pumps and oxygenates your blood for you. If it's the kidney-attacking strain, we hook you up to dialysis to clean your blood. Basically, we do everything in our medical power to keep your organs running while we pray your own immune system fights off the invaders.
Because those clinical outcomes are just so severe and the treatments are incredibly grueling, we arrive at our final and definitely our most important point. Thing 5, protecting your home.
Simply put, the absolute best medicine in the world for hantavirus is separation. You have got to keep wild rodents entirely out of the spaces where you live, where you work, and where you play. Check your foundation for cracks, seal up your summer cabins, put all your pantry food in heavy plastic or glass containers. Literally, just don't give them a single reason to move in with you. But let's say you do find droppings in a shed or an old vehicle. Stop what you're doing and follow this cleaning protocol to the letter. Step 1. Always glove up with plastic or rubber gloves. Step 2. Throw open the doors and windows to air out the space for a while first. Step 3. Completely soak the area down with a bleach or disinfectant solution. And Step 4. Gently wipe it up with a wet sponge or mop. I literally cannot emphasize this last part enough. Do not, under any circumstances, use a broom or a vacuum. Sweeping is exactly what launches that dried viral dust right up into the air for you to breathe. Keep it wet and keep yourself safe. So, we've walked through the whole shebang today. We covered the zoonotic science, the sneaky flu-like symptoms, the really intense ICU treatments, and those super strict cleaning protocols. Now that you know exactly how this virus operates, I want to leave you with one final question to think about regarding your own home. Look around your attic, your shed, or your garage. Are you unknowingly sharing your air with an invisible threat? Thanks so much for joining me for this explainer. Stay informed, keep the mice out, and above all, stay healthy.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.